So for those of you who don't know me, I'm Ron Daniels, and it's my privilege to be the 14th president of Johns Hopkins. It's a particular privilege to be able to chair this last session at what I understand has been a whirlwind day as we've explored disparities within our community and beyond. And not surprisingly, at the end of a day of thinking about different policy options and institutional arrangements, the question becomes one of, well, where do we go from here? And of course, as we know well, a big part of any agenda for reform ultimately must address the resource constraint, and where in particular we're going to find resources to make a difference in terms of setting new policy priorities or achieving the existing priorities in a more efficient manner. It's in that respect that I'm really pleased that we have our panelists here from the region's top foundations. And I would say I've had the opportunity to work with each of the foundations in the 4 years that I've been at Hopkins closely. I count these leaders as not just professional colleagues, but great friends. And what's so striking about the people whom you're going to hear from and the foundations they represent is the extent to which so much of what we see in Baltimore today and say, this is really innovative, this is interesting, we are responding to community challenges in a way that is distinctive from other cities or regions, really can be traced back directly to the vision, the courage, and the fortitude of the foundations and people who are at the table today. And so we're really lucky that they're here. I would say, people said that earlier today before lunch, the crowd was larger. I say to the foundations represented, this is a shakedown process, but the people who are here now understand the fundamental role that philanthropy plays in the community and how much in the way of resources you have to bestow on us all. And so this is your key constituency. I know that at the end of the session, the reward for you coming to this last session is that you each get one $25,000 ask that will be no doubt responded to affirmatively and vigorously by the foundations represented as just a kind of way of inducing your full participation to the end of the program. What we have done in thinking about this program, we're hoping to make this interactive and to have time for questions and debate. But what we thought would be a good start off is that is to have each of the individuals who is here talk a little bit briefly about their priorities for Baltimore, and in particular to discuss one or two areas where they feel historically their organizations have made a real difference in the trajectory of Baltimore and where they're imagining focusing their efforts going forward. And then from there, what we'll do is double back and have a conversation and see where the areas of overlap are. I think it might be useful, particularly for people in the audience, to the extent there are new and bracing ideas you heard today that you'd be interested in getting a sense of what is the taste for foundations to move in this or that direction. This would be a good body, seriously, for you to check those instincts with. And so with that, I'm going to turn it over to Amy Klein from the Weinberg Foundation. Just one last thing before I do that is just to say to Bob Blum, thank you for organizing this day, for sweating this program and for literally months. I think it was several months ago that you first approached me about this panel. And this and in so many other things that you do for the city of Baltimore and the community of the city of Baltimore, you are a wonderful leader and a great citizen of our city, and we're very lucky to have you here. So thank you, Bob. Amy, 5 minutes.
Good afternoon. Thank you, President Daniels, and thank you, Professor Blum. It's a pleasure to be here. I am with the Harry and Jeanette Weinberg Foundation. I direct our basic human needs and health program area, which includes homelessness, food security, economic assistance, and access to health care. And it's funny because when we were asked to participate in the Social Determinants of Health panel, I had to sit down and think, I don't really go to work every day and look at the work we do through this lens, but certainly so much of what we are doing does impact the issues that we've talked about here today. So just to tell you a little bit about the foundation. We were founded in 1959. We are based here in Baltimore, office in Owings Mills. We grant approximately $100 million every year to nonprofit organizations focused on, we make our grants to nonprofits that provide direct services to the poor and vulnerable. And we focus on older adults, workforce development, disabilities, education, and as I said, basic needs and health. We make grants throughout the United States, in Israel, and the former Soviet Union. But approximately 30 to 40 million annually stays in Maryland, and probably 20 to 25 million of that right here in Baltimore City. So it's fair to say that we do place a very high priority on the Baltimore area when making our grant decisions. And even when we make grants outside of Baltimore or outside of Maryland, which we consider our hometown community, we do that with an eye toward bringing lessons here to our community. If we see a really great model that we think we can learn from or that our population can benefit from here in Baltimore, we'll invest in that with the hope that we can bring what we learn here to Baltimore. It doesn't always work, but it does help us kind of build upon lessons that are happening around the country. And we also want to strengthen the capacity of our partners here in Baltimore, because there are a number of things we'd like to do, but we just don't have the organizations prepared to do those kinds of things. So let me just give you a few examples of recent grants made in Baltimore that I think are addressing inequalities. One, a big partnership that we're involved in is East Baltimore Development, or EBDI. And interestingly, at lunch, I was sitting with a few graduate students who were talking about this development that was happening around Hopkins, and I said, oh, that's EBDI, and they didn't know what it was. So I had the opportunity to tell them about that. So our investment of $15 million has been entirely on early childhood development. And I say that to tell you that our board has recently made a conscious decision to increase our investments in early childhood because of the indisputable data that points to the importance of early childhood education and bridging these gaps. Another example is our support of federally qualified health centers. The Weinberg Foundation makes a considerable amount of capital grants, so capital projects, and a number of these are to the federally qualified health centers. So while I can't prove to you, I don't have the data in front of me to prove to you that the health centers are reducing inequalities. That is why they exist. They are in medically underserved areas to reach the uninsured and underinsured. We've been investing in them for many years. We think they're going to play a crucial role with health reform, and they are preparing themselves. They're expanding to offer more services, dental care, mental health, to really be that primary care provider that's so needed. Last year, the foundation launched an elementary and middle school library project, which is turning libraries in Title I Baltimore City schools into inspiring, creative, and technologically equipped spaces. Congressman Cummings was talking earlier about how important it is to show what's possible, to create high expectations, to help kids dream, and we think that this is a small part of that. We will continue 3 libraries a year through 2015, and one of our goals is to help close that education gap. And finally, so far we've invested $2 million to create what's called deeply affordable Weinberg apartments for young people with disabilities. $1 million gets us about 8 apartments, which sounds like a small amount, but it means that the rent is about $200 a month to make it affordable for people who wouldn't otherwise have access to this housing. So we'll continue focusing on this core mission. It is our job to address these basic needs, and I look forward to your questions. Thanks.
Of the ABLE Foundation, I just think we should all take note of Amy's scrupulous attention to the time that she was allocated, and that I know that sets a precedent that you will be anxious to emulate and respect. Mr. Embry.
I have to take that under advisement. Foundations, there are a number of interesting choices that are made to lead us here today. One is that some rich person, usually white, decided to leave their money to create a foundation rather than to leave it to their heirs or the college of their choice. And it's interesting that when I began public life in Baltimore 45 years ago, there were really no foundations in the city to speak of. Now there's $6 billion in assets roughly and local foundations. Second choice that's made is by the foundation or their donor as to what they're going to do with their money. And the foundations could devote it to religion or to arts or to higher education or environment or to a number of things. But it's further interesting in Baltimore that almost universally the foundations here are focused on poverty and focused to the extent they're local foundations on the city and to the extent they're national or international foundations like Casey and Weinberg, the portion of their assets that they devote to Baltimore are almost 100%, if not 100%, devoted to issues of low-income population and in the city, not predominantly in the city, not throughout the state. So those are choices that nobody required to be made, but have been made. Now, in terms of our foundation, like the Weinberg Foundation, the other foundations here, we fund a number of things, school health clinics, obesity programs, lead paint programs, vision programs, programs to reduce rat population in the city, and so forth. But there are a choice that foundations can make, and one that we make, and some others do, is to try to be an advocate because our resources are very limited. And while $6 billion is a lot of money, and the portion that's given in Baltimore of all the foundations will say is $100 million a year, the budget for the Baltimore City school system is $1.3 billion, and that's just talking about the school system. That's not talking about all the other programs in the city. So while it's a lot of money, it is money on the margin. So a question is how, or a question that what might be asked is how do you leverage that money to achieve a higher result? So just to mention a number of things, one, since ACLU is here, we funded them to do a study on the physical structure of the school system of buildings in Baltimore. And their report resulted, as you know, or those of you who follow these matters, in over $1 billion appropriation from the state and the city to improve the infrastructure of our city schools. Vinnie DeMarco talked about the cigarette tax. That again was an investment in Vinnie by us and others to advocate for higher cigarette tax and therefore lower cigarette fatalities. The liquor tax, first increase in the liquor tax in over almost a half century came about through a study that we funded at the Bloomberg School that was quoted widely by the General Assembly and led to the change in the taxes. The school funding, Baltimore City a number of years ago was 23 out of 24 in per capita school funding. We financed a study by a law firm in terms of what theory could be brought to change that. As a result of that lawsuit, Baltimore moved to third out of 24 jurisdictions in the state in terms of per capita funding. The gun law that just passed almost uniquely in Maryland, the background checks and the fingerprinting, again funding Vinnie DeMarco, who led the citizen effort to get that change. And the liquor store that effort that Dr. Barbeau referred to was in part helped by a study, again, we funded the Bloomberg School on the effect of liquor outlets. So in picking one out of all of that, we're here to talk about health disparities. I mean, there are a lot of discussion today about a whole variety of issues, but clearly health disparities, and you heard it before, you knew it before you came in here, is caused by the disparity in income. If everybody had enough money, the health disparities would go away. So there are two things about health disparity, about income disparity. One is raising the income of people who are poor, which is very difficult and requires a national income support effort and an employment program that hasn't existed really since the Depression in any scale. But the second is changing the neighborhood in which the person lives. If a person lives in a poor neighborhood, they're going to have poor health outcomes, all things being equal, even income being equal, if they live in a middle-income neighborhood. And so the most important thing I would cite that we've been involved with is the Thompson case, which Barbara Samuels is here today, is the lead on that, which is helping over 4,000, almost 4,400 families, low-income families who want to move from areas of poverty concentration to areas that are low in poverty concentration, and having dramatic, almost overnight health impact in terms of asthma, in terms of mental health, in terms of obesity, and is arguably the quickest health intervention that you can make. And the final point I would make is that Dr. Marmot's presentation this morning was very instructive on one point, and that was Birmingham, to me at least, that was Birmingham, England. They allegedly came up with a specific strategy to affect specific outcomes. And I would hope the Bloomberg School, as a result of this meeting today, in the future would help with Dr. Barbeau and Dr. Sharfstein at the state, would come up, and I know Dr. Barbeau is working on this already, with specific interventions that will produce specific measurable outcomes. There are a whole range of measurable outcomes that you could pick, from whether you can see, whether you can hear, your obesity, out-of-wedlock birth, prenatal care, I mean, a whole group of measures, but we could select some specific ones and hold ourselves accountable next year to what difference we've made. Thank you.
Patrick McCarthy from the Annie Casey Foundation.
So good afternoon. I want to share with you the story that Casey tells itself about its national work, but also about our work here in Baltimore. And it has three parts. The first is essentially the question of what kind of Baltimore do we want to see in the next 20 years, 30 years, 40 years? Where are we headed, and where do we expect we're going to end up if we continue on the same path? What are the greatest threats to our capacity as a city to compete? What are the greatest threats to our prosperity? What are the greatest threats to our vibrancy? What are the greatest threats to our social cohesion? And I would argue, as others have argued throughout the day, that among the greatest threats to all of those things is the lack of opportunity that too many of our citizens experience. That, in fact, that lack of opportunity, that lack of ability to move from where you start to where you might want to be, that lack of social mobility contributes to many poor outcomes, including some of the health outcomes that have been discussed today. Now, that's kind of an easy thing to say. It's very straightforward, but it's broad. And you get to the second part of the story, the question of if that's the case, what are the key factors? What do you tell yourself that are the key factors that lead to this problem of a lack of social mobility? And at least at Casey, and you'll hear some of the same themes that Bob just sounded, at Casey we think there are three major things that predict lousy outcomes for kids. Annie E. Casey is a children's foundation. That's our focus nationally as well as in Baltimore. So we look at what predicts bad outcomes for kids. And we think there are three things. Number one, we know that a child who grows up in poverty, as Bob said, has long odds of being successful. That in fact, not having a path towards opportunity can lead to a whole range of lousy outcomes. However, many kids, in fact, most children who grow up in poverty actually do okay. And why is that? Well, it's the second piece. It's because they have a strong family. They have resilience. They have a network of folks who support them. Lots of folks in this room, I'm sure, grew up in circumstances that weren't necessarily ideal, but we did okay, and that's because we had a strong family. That's the second thing that predicts outcomes for kids, the family. And the third, again, as Bob said, where you grow up makes a huge difference. Do you grow up in a place where you're connected to opportunity? Do you grow up in a place where there are role models, that has safe streets, that has good schools? Even if you're poor, you're going to do a lot better if you grow up in a neighborhood like that than if you grow up in a neighborhood where there's no investment. Now, we think about these things as the three Ps, just so people can remember them at the foundation: poverty, permanence, that is a permanent connection to a strong family, and place. But even then, now you've got a still fairly broad range of things to think about, and I would just share with you what Casey uses when we make a decision where we're going to invest, and suggest that it's not a bad thing to use if you're thinking about where to invest to turn around bad outcomes. We use family evidence and scale. By family, what we mean is that we believe that you've got to have a simultaneous two-generation strategy in all the work that you did. So that's part of what we mean by family. A lot of research we could get into about some of the developmental issues here, which we can get into later if you'd like. But the bottom line is kids do better when their families do well. Investing heavily in early childhood is an important thing to do. We advocate for that. and at the same time investing heavily in the parents of those children, rather than some sense that we need to rescue children from bad parents. Let's invest in the parents at the same time. The other reason why we use the term family is because we believe strongly that we ought not be investing in anything that we wouldn't want for our own children. Does it pass the My Child test? If I'm perfectly comfortable having one of my children locked up in a juvenile correctional facility that has lousy education and lousy programs, okay, but I'm not. So we invest in turning that kind of thing around. Second, evidence. There's a lot of back and forth in the literature and in some of the rhetoric about, well, we should only fund things that have randomized clinical trials, et cetera, and the other side saying, well, we don't know enough to do that yet, et cetera. We just believe you need to use the best available evidence, and we don't often do that. We believe we need to invest less in programs that have been tested again and again and have in fact come up short. And as importantly, and this is the piece that is often missed in this debate, we have lots of evidence about things that harm children. And in fact, we spend more of our public money on things that harm children than we spend on things that have solid evidence that they work. We spend more money on incarcerating children. We spend more money in putting them in impersonal congregate care than we put into prevention and early intervention. The evidence would suggest we should go in a different direction. And finally, scale. What do we mean by scale? Well, one of the things we don't mean at Casey by scale is taking a program and simply replicating it, the sort of franchise model. If you've got 5 programs and you take it to 10 or to 15 or to 20, that's scale. Not from our point of view. In fact, what we mean by scale is, can you change outcomes at the population level for an entire neighborhood, an entire city, an entire state? And what are the strategies you have to do in order to get there? It's part of why we invest so much of our time and energy into public system reform, because in fact that's one of the paths, not the only path, but one of the paths toward scale. So I'll stop there and be happy to take questions later. Thanks.
Thanks, Patrick. Thanks, Patrick. Tom Wilcox from the Baltimore Community Foundation.
Thank you. I need to take a test of myself when I begin speaking. As a stutterer, if I'm stuttering a lot, I'll take 2 minutes, and it'll take 5, or if I'm not stuttering, I'll take the full 5. So we'll see how that works out. I want to take on the title of Changing the Trajectory, because as Bob pointed out so well, the trajectory has changed in philanthropy in Baltimore in significant ways. Before Bob Embry and his colleagues started investing in such a focused way that has led to such change, before the Casey Foundation arrived in Baltimore, before the Weinberg Foundation changed its focus, before Johns Hopkins committed to Baltimore in such an important way, before the ACLU started shaking things up on housing and on education funding and on education construction, all of those things have happened since then, and we're living in an entirely different place. I was asked in this list of questions, and how do you set your priorities, and how do you engage? And it's an interesting question, because once again, that trajectory has changed. We grant between $20 and $25 million a year in Baltimore for various ends. Of that 20 million, some 2 million is what is called discretionary, dollars that have been given to our board to use at their discretion in a strategic way. And for the next several years, we're going to invest in education in neighborhoods to try to change some things. The other $20 million comes from our donors. And our donors have stepped up in significant ways. In the 1990s, they gave away between $3 and $4 million a year in Baltimore to effect change. In this past decade, as I said, they've averaged between $20 and $25 million, because they have seen the opportunity to co-invest with people and to make a difference in a region that indeed is changing and where that trajectory is changing. Who would have guessed that there would be a 98% reduction in childhood lead poisoning over a 20-year period from 1993 until 2013? Who would have guessed that there would, in 12 years, been an increase in school readiness from 27% to 78%? Who would have guessed that the teenage birth rate would have dropped from 83 per thousand 10 years ago to 51 per thousand in this past year. Who would have guessed that we would have gone from 5 to 55 choice schools? Or perhaps more important than just forming new schools, that 26 schools have already closed, and with the new construction going on, 26 more schools will close. They're having fits in Chicago over the idea of closing, I think it's 40 schools, and their system is I don't know how many times larger than ours. So there is a lot going on, and the question really becomes, if the trajectory has changed, what do we do now? How do we respond? As I said, we're going to focus on education and on neighborhoods. In education, we want to build on work that's already going on school readiness. We would like to see Baltimore have 90% of its children ready for school by 2017. We would like to see our school leaders have the autonomy, the relationship between autonomy and accountability that's necessary to run a school well. The dollars might follow the students. They might talk about autonomy. It's not there yet. We're working with the Noyce Foundation and their grant to the Fund for Education Elections to determine both to have a better principal pipeline, and then once these men and women are in place, what can be done to give them the freedom to be able to act. And then how do we leverage in school effectiveness, how do we leverage the fact that the school system is now measuring, is taking a look at, through the school effectiveness reports, what schools are working? How do you affect both practice through your grant making, your initiatives, and your advocacy, and then how do you publicize what schools work and what schools don't so that you can inform choice so that parents are making intelligent choices? And then we're asking ourselves, how do we effectively take advantage of the fact that among the foundations that are here, we're a public charity, and to the extent that we're a public charity, we're allowed to engage in advocacy, and we have. And our board has gotten a taste of it, and they love it. And whether it came from fighting the governor on the fact that 4 years ago he wanted to reduce the school allocation from the state by $32 million, to being a partner in getting the Race to the Top legislation passed, to being a partner with the ACLU and Transform Baltimore and getting this fabulous school construction project done and trying to be a private sector voice in that, to continuing to work on our very weak and broken charter school law. How do we represent the collective interest of all of our donors in effecting significant change, and particularly given the fact that we have limited resources there, how can we use our ability to take advantage of the collective interest of our donors? We've got 3,000 donors who follow us on email, and when we engage in advocacy, join us in making a difference. We've got somebody who's 28 who does my Twitter, and I don't even read it, much less do it. But she's in touch with thousands and thousands of people. I trust her. I have no idea what's going on, but I trust her. And so how do we take full advantage of that as we look forward? And how do we set a goal around which we can all get our arms? Some regions have said, let's choose some measure of post-secondary achievement for all of our children. Others have set other kinds of goals. I might posit today, President Daniels asked me for a number, and I said perhaps we could, in time, reduce the number of children born in Baltimore City who are Medicaid eligible. In spite of all that change, still 2/3 of our children who are born in Baltimore City are Medicaid eligible. That's an appalling statistic. But the fact of the matter is that if we can reach the parents of the next generation sooner rather than later and help them get a better education, they will naturally delay the childbirth for their next generation and make a difference. And also I would ask this institution, what can we do about the fact that fabulous potential growth in Baltimore's economy could be stalled by the failure of our workforce to respond to enormous opportunity? Forbes magazine reported that there are more high-tech jobs available in greater Baltimore than any other city in the country except Seattle. That's the good news. The bad news is we don't come close to having the workforce to fill those jobs. What can we do to get people to come to these great universities and to stay in Baltimore and to fill those jobs? How do we fill the information gap between the obviously enormously capable young people in our schools and the jobs that are waiting for them? So the trajectory has changed, and I would posit that we're only going to continue to change by having some big goals. So thank you.
Let me start
start by just thanking our panelists for kicking us off and for all in a very succinct way, but setting out a pretty impressive set of ideas and an agenda for action within the city. Let me, having done that, turn and ask the group, a question that I think is on the minds of many of us. Is the extent to which we need to think about other mechanisms or ways to coordinate efforts across the various groups that are represented on the dais today, and perhaps more generally within Baltimore. Clearly one of the things that we've heard from each one of you is the importance of having your investment as a way of setting agendas, providing demonstration projects, generating data, and in some sense moving the broader policy process and getting other investments to follow and train. And so in that spirit, it is important that there be enough scope here for local initiative and experimentation. On the other hand, when we think about the kind of goals that we're talking about here and the comprehensiveness of the interventions necessary to really move the needle on them, the question is, even taking the interest, let's say at 5% on $6 billion of endowment, if every cent of that were spent in Baltimore, it's still a relatively small amount of money relative to the agenda we have before us. And so then the question is, do we have to think about ways of integrating, coordinating, so that we can actually see that the sum of all our efforts is greater than the parts? Who wants to kick off? I was going to call on you in a minute anyhow, Bob, so.
Well, I'm somewhat skeptical of the assumption, but it certainly is a debatable one. The difficulty, or a difficulty, is if you were to decide, for instance, is how you're going to spend your money. You're going to spend it on elderly poor or young poor. Or if you're going to spend it on poor people to begin with, or low-income people to begin with, is a decision. And then if you decide you are going to, what age group are you talking about? And then if you decide that, and there's no right answer to that, there are arguments you can make for any decision you make. But say you're going to focus on low-income children. Well, what intervention are you going to choose? Are you going to choose schools or health? I mean, just take two, but employment, drug addiction, recidivism. And then if you take, I'm going to take health as an example. As I alluded to in my remarks, what aspect of health are you going to focus on? So yes, it would be easy or at least conceptually easy, for all the foundations in Baltimore to say we're going to focus on obesity. And we're going to take all our money to do that. Now, would that be a wise decision? And is that the most important intervention you can make? Or we're going to focus on third grade reading? Or we're going to focus on college completion? Or we're going to focus on job training? So a difficulty of getting everybody on the same wavelength is deciding what wavelength you should get on, and are you ignoring everything else if you do that? So it's a debatable and interesting question.
Is there something, though, short, and I appreciate you're being provocative, and so the kind of the stylized, we're all going to worry about obesity, as of course, that's an extreme framing of the question I've asked, but is there something short of that where you would say, because again, the theme of children has been picked up by virtually every speaker on the panel, is there something about saying that we are going to have the initiative on children, or Baltimore's children, and recognizing that in that context, there are a number of different ways in which each of the foundations here and other related organizations will tackle that issue with a view. There's a multiplicity of instruments, multiplicity of measurables, but nevertheless, something where it's more concerted, more harmonized, not homogeneous, but more harmonized than if we just, again, are moving in a more atomistic way. I'm not sure I believe this, but I'm asking the question.
My turn.
So I think that the diversity in philanthropy is actually a good thing. And in fact, even if it weren't a good thing, our donors and our boards would stop us from coming together as a common turn to decide how to invest. Having said that, I think not just within the foundation sector, perhaps potentiated by the foundation philanthropic sector, if multiple sectors can come together within particular areas and agree on a common set of results, and staying in our own lane, in other words, the areas that we are strong on, simply try to contribute to that common result, I actually think we'll make more progress than if, Tom funds a report on, making it up, on early childhood, and I fund a report on early childhood, and we hire two different groups, and they each come out with a report that says Baltimore ought to do X and Baltimore ought to do Y. That's just kind of dumb. So I think that agreeing on common results, sharing strategies, is well short of the notion of some kind of consensus or vote that we're all going to do obesity, or we're all going to do early childhood, or whatever. Having said that, there are also national resources and local resources that we can bring to bear if we have a clearer sense of what collectively we're trying to achieve. There's no reason why each of us as separate foundations, and the other one's not represented here, as well as the other sectors, ought to all go off and invent our own set of what the expertise is on each of these areas. We ought to pool our resources, pool our knowledge, and recognize that in this world there are some things we've got some good evidence on, and we ought to pursue them, and some other things that may be promising, but we ought to share that across. And then I think the final thing I'd say about this is each of our organizations on this at this table actually have different strengths that actually are quite complementary. I mean, the Community Foundation can do things that the Casey Foundation can't do, the Able Foundation can't do, and the Weinberg Foundation can't do. But your efforts complement what each of us do, and I think that's a reason for us to figure out how do we get that complementarity that'll get better results.
Tom,
I think the common goal is really important, and I think also all the growth to $6 billion in assets is important. We need more partners, and we need something that can sell. Bob has often said that we need to think strategically about things. I think we also need something that the person who's entering the philanthropic arena can get his or her arms around and invest in with some sense that there'll be a return. I also think we need to engage in releasing market forces and effecting this change. The Able Foundation has been a key investor, along with Casey and many others. Weinberg in Healthy Neighborhoods, which over 13 years has changed the trajectory in what is now 41 neighborhoods by focusing on middle neighborhoods and helping homeowners invest in their own neighborhoods, and what that has done for people's individual wealth on the one hand and the tax base of the city on the second, and the strength of the neighborhood overall is really profound. And to what extent can we take a look at Baltimore as a city and as a growing and thriving city, and the extent to which we can rebuild the tax base such that we have the public resources necessary to reaching the kind of ambitious goals you're talking about.
Amy, before I turn it over to the audience or ask another question, you want to weigh in on this?
I think they've captured it very well.
Okay. Question. Isn't that where did that come from? So like that's just now people were doing this, or just?
Well, I'd love to take a look at that first question. I'm proud of the fact that on a staff of 28, I'm the only straight, white, Anglo male. So we're making progress. And I'm so old that even that'll get fixed pretty soon, but not too soon. But we must. Our community foundation has decided that a comprehensive commitment to race equity and inclusion in our governance and our daily practice and our grant making and our initiatives and our advocacy is fundamental to the future of Baltimore. And until we recognize what separates us, we're not going to fully understand what we have in common. So I share. It's a great question.
Can I say something about that? That is a great question, and I'm not surprised it was asked. So thank you to the person who asked it. I recently participated in a session that was led by Public Allies called Everyone Leads, and it's just an effort to look at how do we develop diverse leadership for primarily our nonprofit sector, but also government and philanthropic sector, and what responsibility do we all have to play in changing the face of our organizations and the people who lead them. We need great leaders from diverse backgrounds. You know, I won't say that I have the solution, but I will say that the conversations are happening, and you know, I encourage those of you who have an interest in being leaders in this field to reach out, to find mentors, to talk to folks in the field, and aim high, because we need you.
Can we take a stab at the second question? We'll just go through these. Bob Embry, do you want to take a first shot at this?
When you say Baltimore's historic residents, what
People
does that
already
mean?
here, you mean, I guess that means.
That were born here, you mean, as opposed to moved here? I don't know what historic means, but in any event, whatever the modifier is of residence, how do foundations include a larger community in their decision over how they allocate their money? And that depends on the foundation. I personally, our foundation, meet with community groups and community advocates all the time, go to meetings like this and as many meetings as possible to hear what the community is saying. I ran the public housing agency for 10 years and have some sense of the resident viewpoint of the poorest population of the city. I'm on the school board for a number of years dealing with the school system problems. So we all, to varying degrees, spend most of our waking hours trying to understand what's going on in the community. I can't stress too strongly that it is a policy decision of a foundation where to invest their money at all, and a decision that is made by each of these foundations could have been made to not give a cent in Baltimore City, or if in Baltimore City, not to low-income needs. I'll go to the Baltimore Museum or Gilman School or the Symphony or various other people who would like and deserve money. So you can look at the glass half full or half empty, but anybody here, I'm sure any of the four people on the stage, anybody here that would like to come in and discuss how they think our foundation should spend their money in a different way, we'd be delighted to hear what they have to say.
In some cases, it's preordained where you're going to spend your money, or at least in the areas. And in our case, we have 650 different philanthropic funds that range in size from $10,000 to $10 million. And in many of those cases, donors left us money with very clear orders about how we should spend it. And that's the only thing that's sacred at BCF is donor intent. And, but obviously, we're going to pay very close attention to the community in terms of how we then go about spending it. When it came to deciding on education and neighborhoods, we engaged in focus groups with 350 different people, and engaged online with several thousand more people in doing an inventory. But ultimately, it was the decision of our Board of Trustees, which is a diverse board. It's not perfectly diverse, but I characterize it as either the most powerful of the diverse boards or the most diverse of the powerful boards. They made a critical, hard decision to do that, bringing their expertise and experience to bear.
In the case of Casey, what we have invested in over the last 20 years nationally heavily is on contributing to local community groups representing residents in various and sundry kinds of ways, ranging from nonprofit organizations to essentially grassroots groups, with the notion that we've got to lift up the voices of folks who are impacted by the work that not only we do, but that are impacted by various systems. We invest heavily on in the consumers of various services. So we've got an entire portfolio that invests in the parents of children who are incarcerated, so their voice is lifted up. We are sometimes quite clumsy, I think it's fair to say, in how effective we are in structuring meaningful as opposed to symbolic input and influence, if you will. I like to think we're getting better. I know that we're not getting better as fast as we need to get better. But.
Oh, I would echo donor intent. In our case, our priorities are fairly set by our founder in a written charter, and we do think it's our responsibility to shepherd his wishes. For example, we cannot fund research, advocacy, or policy. And this goes back to the question of how we complement one another. There are other foundations that don't fund as heavily in capital projects as we do. And so, you know, we need each other. Sometimes I think folks don't understand we don't place these restrictions on ourselves. We do them because it was what our donor had intended. Another was we don't fund universities or cultural institutions because he really wanted the funds to go to the low-income populations. And I just want to bridge to the next question. I think they're talking about the 5%. The 5% of assets is the minimum amount required by the IRS to be distributed annually. And again, in our case, our charter prohibits us from exceeding the 5%.
But there, do you want to say something? Anyone want to say something? I think the question is about social investing and how the endowment is. I'm not sure.
Oh, I thought somebody had referenced the 5% of the $6 billion, so I think that was the 5%. Yeah. So the other 95%, I think, is the corpus.
Yeah. So in our case, and this is a huge debate in the field, in our case, we've taken a proportion of our endowment, so set aside the grants that we provide on an annual basis. We've taken a proportion of our endowment and set it aside for social investing. In other words, what we hope to be double and triple bottom line return. Some return on the investment itself, although usually much less than we get from the balance of our endowment, but also a social return from that investment. The controversy in the field is, well, you want to do something charitable. Does it make more sense to make more money on your endowment and then you have more money to give away? Mm-hmm. Or does it make more sense to take a portion of that endowment, and in at least one foundation I know of, they're taking their entire endowment, and invest it in things that are socially good? We've decided from our perspective, as Tom said about affecting market forces, that we may have opportunities to use the kind of flexible patient capital that Casey can bring to bear in order to influence other capital to flow into communities, for example. So we've got about $125 million in play in various places around the country, a whole big bunch of that locally, in order to attract capital to activities that we think will benefit low-income folks.
Our policy on the social impact investment of our endowment is that with 700 different bosses or 700 different funds, the capacity for us to do that and still have the confidence of our donors it's too broad. But we in fact do both. That about $20 million flows in and then out of our foundation every year by people giving to us and then working with us to give it away, and that's outside the endowment work. On the other hand, we're constantly talking with donors, particularly as they build their estate plan, about leaving us money in their estate for a permanent investment in Baltimore. And all the data suggests that if it's going to be a permanent investment, you can't spend more than 5% of the value on an average in a year, and some people say it's closer to 4%, and retain the purchasing power of that endowment. And so if we gave away more than that, we simply would see the value dissipate and we would not have met that donor's intent. So, and also, if you take a look at the dollar value of a dollar goes into endowment versus into the community, there's a cogent case to put that money in the endowment and let it grow and have it give away many more times than it might have otherwise. But it's complicated stuff.
Yeah, there are a couple of decisions that are made and they're debated. First is, do you limit yourself to 5% that you're giving away? And one test of that is, are you a self-perpetuating foundation or not? If you're self-perpetuating, you have an obligation to the person who gave you the money to perpetuate yourself. If you're not, you can give away all your money and go out of business. So you give away 10%, 50%, or you can give away 100%. All of the foundations here act as self-perpetuating. That is, that they plan to stay in business and therefore give away roughly, as Tom pointed out, what can be given away and still sustain your ability to give away money. The other decision is with the corpus that you invest. How do you invest that money? And again, that is a debate amongst foundations. The norm is you don't let the fuzzy-headed giveaway people stick their nose into the hard-headed investment decision. So you have an investment committee made up of bankers and lawyers, and you don't let the soft side of the foundations come in the room. We take a little different view of that. We think that we can do well and do good. So we invest in startup companies that either in Baltimore or locate in Baltimore and that do something that benefit mankind. And we've made more money on that those investments than we have on our traditional investments. That could change tomorrow, and we could look foolish. But in any event, that is a decision that is within the discretion of foundations to make, and you can argue both sides of it.
I'll just give you a quick example of just how anxiety-producing this can be. We house one foundation for a family, and the corpus of that foundation over the course of 2007 and 2008 dropped from 5 million to 3 million, which was not unusual in this world and that stock market. And they went through the wrenching decision: do we give away 5 or 10% of what we had last year and take it even further down to perhaps 2 million, or do we stay the course and hope it'll come back? And they made the wrenching decision to stay the course, and it came back, and it's now worth $5.25 million, which means that it is generating $225,000 a year, and it would have produced half of that had they not stayed the course. So these are complicated decisions, and in our case, we have so many, we have a lot of individual decisions being made.
There's a last question here. Bob, are more questions going to magically appear once we get through these, or this is so? On that last question about the Latino population, do you want to take a shot at that, Tom?
Well, we're just really thrilled that the Latino population is growing, and we aren't doing nearly enough in this area. But Kevin Griffin Moreno, one of our program officers, is deeply aware of what's going on, and anything we can and must do to build all populations, but take full advantage of these new Baltimore citizens. It's an exciting opportunity. We need to work together.
Mm-hmm.
Amy?
I would say the question seems to suggest that there's competition for resources, and of course there always is, but on this question, I don't see it that way at all. We certainly support again, our grants are made to nonprofits that work with diverse groups of people, Latino population being among them. We support organizations that are working over in Highlandtown, where there is a large immigrant community, large Latino community, and we're happy to entertain requests that would benefit this and any other population.
Great. Let me just, before we conclude the panel, let me just throw out one last question to the panelists. And in some sense, this grows from a few comments that came up during the course of the last hour or so discussion we're having. And that is, you folks have all been deeply immersed in the city. You have brought best practices into the city in terms of a number of different initiatives that you've mounted in areas from homelessness to healthcare, education, and so forth. But a lot of this, as we've said before, is about trying to influence and get government to do something for you and to make some change in behavior that will make for a better community. And I think the example that was thrown out earlier about just the high rates of incarceration and what this is doing on so many different dimensions is really antithetical to what we want to see happen. So here, the last question I have for each of you is, if the gods were to smile on you and give you one wish to say you can get one policy change, one new program, something to happen that really reflects your sense of where we're stuck, and we could get market improvements in the state of our community, what would that one wish be? What's your one?
National or local? You
decide. It could be national, local, could be state level, but what's your one desired policy initiative that you think would really help our community? And I guess I'm going to start with, at this end of the far end of the table, Tom, and ask you, is it a better choice law for charter schools? Do you have something else in mind?
Well, that's our immediate advocacy priority, is getting the the charter law change, but I'd like to come back at the end, see what others have to say.
You're double dipping, but that's okay. It's for a good cause. Patrick.
Yeah, it's tough to choose one policy arena from the Casey perspective because we're in so many different areas. But I think if you asked me to choose one area, I think I would choose investing a whole lot more than we now do in the whole range of school readiness initiatives. It would have to be, very data-driven, a lot of accountability built in, and again, whether locally or nationally, I think in terms of a multiplier effect, that would have the greatest multiplier effect, along with the other things that are already going along fairly well. But it's a tough choice.
Bob.
Well, there are two types of things. One, things that cost money, and there needs to be more money in our system, social system, and that involves our taxing nationally. So I would change the tax laws and reduce the disparities in income in this country and provide full employment. But that's a gross, if you get down to the local level, one thing that's intrigued me is having a city that, instead of its present limits, is really a metropolitan city like Houston or Nashville or other cities. The disparity in tax rate between our city and the suburbs is something that's going to be a continuing issue for the foreseeable future. And on the minor scale, decriminalize marijuana, I guess.
That'll go down well with this group. The tax policy point.
Yes, I agree with
Amy.
you on the city-county. I would like there to be more affordable housing. I don't have an answer. There's a limit to the amount of long-term government subsidies that we have access to. We need capital investment to actually build more of this housing in a way that mixes communities and does not concentrate poverty. I don't know what exactly the policy looks like, but the goal is safe and decent and affordable housing for many, many, many more people.
It's great.
You allowed me to come back, so I want to come back with a micro and a macro.
I was just saying that's great, but now we're going to get some really stirring thoughts from Tom Wilcox.
Oh, no. Not stirring, but a micro one. I was very impressed by an op-ed in the Times several weeks ago about teaching as a profession and the extent to which our legal profession, our medical profession have very clear standards and ways that help many people reach them. And we do not have that in what is the most important investment we make in our society, which is in our children. So if we could do something about teaching as a profession, and I see Dean Andrews in the audience, if anybody can do it, he can. And then I would have Congress understand that neither side is right, that free markets do work and the Republicans do need some level of autonomy in having business work, and the Democrats are not wrong when they say that we are only as healthy as all our people are healthy and we have to invest in all people. We had a tradition of hearing each other and finding a beautiful middle, and it's been lost, and I would have that change.
Let me, on behalf of everyone here, thank the panelists. But again, what's critical is that they're here in this panel and have shared so generously of their thoughts. But in truth, what's really amazing is, as I said at the start of the session, I see these folks at all the time around various tables and various projects within the city. And it's not just the financial capital that they bring to really good ideas. It is their passion, their moral conviction, their sense of principle that really has made for a stronger community. So on behalf of all of us, thank you for being here today, and thanks for all that you do for Baltimore.